I am Dr. Pralhad Prabhudesai. I am consultant pulmonary physician practicing at Lilavati Hospital, Mumbai. Today I am going to talk about climatic changes or changing climate and pneumonia. We have seen a lot of pneumonia cases in the practice, and you can say that's the most common problem which we face, that patient coming to the hospital in OPD as well as in ICU, and that is called community acquired pneumonia. What is pneumonia? Pneumonia is inflammation of lung parenchyma. What does it mean? Inflammation of the lung parenchyma which is secondary to bacteria or viruses. So there is some infection which is external agents. It may be bacteria, virus or any other agent which is causing inflammation of the lung parenchyma, means alveoli, and which leads to a pus formation inside. And this can give rise to various symptoms like fever, chest pain and cough, breathlessness. If it is mild, patient can get alright on its own. If it is severe or patient's immunity is poor, then patient can go into a severe pneumonia requiring hospitalization, ICU care, ventilator, and mortality rate is also very high. Today we see much different pneumonias. So does any climatic change has been responsible for the pneumonia? That's a question today which we have in mind. So I will say yes, climate change causes a lot of problems. Climate change is responsible, or air pollution which happened nowadays is also responsible for community acquired pneumonia. The reason is that the suspended particulate material, they produce a different immune system inside, giving rise to a minor pneumonia turning out to be bad pneumonia. That's one. Second, the viruses, bacteria which also come with the air pollution. Not only air pollution, the climate change leads to fires, not probably near Mumbai but outside. Say there are wildfires happens and that causes large amount of dust, smoke, which is also responsible for a pneumonia. Okay, climate change also causes water and fluid and lot of things. Food also gets changed. The patient's immunity also goes down, and that leads to a pneumonia. So climate change in various ways is responsible for change in the immune system, change in the type of bacteria and viruses, and that is responsible for getting a pneumonia of different types and also leading to a serious type of pneumonia. Now there are many organisms which are there. If you see today the viruses, influenza, para-influenza, metapneumovirus and other viruses, they are nowadays we see coronavirus, all those are responsible, and they are now, if you see, they are much and much more happening today in our country. Okay, why this is happening? This may be related to climate. Yes, there has got a role to play. That change in virus pattern which is happening is related to climate, number one. Now the pneumonias like streptococcus pneumonia, H influenza, Moraxella catarrhalis, which are there coming much more serious. Okay, maybe because of the immune system of the patients have been changed, or whatever the antibiotics usage has happened because of the recurrent frequent pneumonias. These bacteria become resistant bacteria and they catch up resistant germs, go into the patient's body, leading to a resistant type of pneumonia. So this is how the pneumonias which are there. We have seen nowadays a mycoplasma pneumonia, much more common and very frequently happening, legionella pneumonia, which we have just heard earlier days. We have able to diagnose them much better now because of the facilities, and we can treat them also better. But still the pneumonia is important cause of mortality and morbidity in our country. So now this is in short regarding the climate change and pneumonia. There are so many factors are there which I have not really touched, like overcrowding etc. also happens because of that. But let's talk about the prevention of pneumonias, like how we generally prevent. So we have seen climate change, made air pollution and the bacterial and viruses pattern changing because of the seasonal thing. We have say also there are other factors like overcrowding, lack of food. All those things are also comes into the climate change, and the extreme weather conditions is also responsible for pneumonia. So I am not going into the various causes of climate change responsible. Let's see how we can prevent that. The prevention of community acquired pneumonia because of the climate change. Okay, we cannot immediately change the climate. That's very important. But we should act like we should try to see how we can prevent air pollutions. How important is planting trees is important and making the earth green. Yes, it is going to help in the big way. Okay. So this second. Third is that food. We should have sufficient amount of food generated. Fourth most important thing is that the availability of healthcare services during this climatic change has to be changed as per need. Okay, and we have to be prepared for that. Fourth most important, which can be done very easily, is vaccination. So we must take flu vaccinations very regularly. In the India, we should take in the month of May, June, July, because our season of flu starts somewhere in monsoon time. And in seriously ill patient, the vaccination can be repeated in even the month of September, October or November, December, that time, so that especially who have got bad lungs and bad other conditions, so they can get a protection better. Okay, the vaccination is not should be only to the patients, but it also should be the caretakers. This is also very important. Children also should be vaccinated, elderly people, and all the diseases which are vulnerable to get serious complications, they should be treated by flu vaccination, because even a simple flu can prevent cardiac failure also and cardiac complications. It can prevent a kidney disease also. The flu can precipitate every disease failure. So flu vaccination is important. Second is Streptococcus pneumonia. Is a very important bacteria which is completely preventable by taking, or seriousness of community acquired pneumonia, especially due to Streptococcus pneumonia, can be prevented by Streptococcus pneumonia vaccine. And we have conjugate vaccine, we have polyvalent vaccine, 23 polyvalent, polysaccharide vaccine, conjugate vaccine, 13 conjugate vaccine. So these vaccines, you should always consult your doctor and take the vaccination for community acquired pneumonia. In India, I think I will recommend age above 50-55, we should try to give a vaccine, because our senior citizen probably may start around much earlier compared to the senior citizen or what the Western world says. We have become early, you can say older compared to the Western people, and hence we should vaccinate our patient little early. Okay, so this is my thinking about it. And there are other vaccines like shingles vaccination, DPT vaccination should be repeated in high risk group of patient which we used to take in the pediatric age group. So these vaccination schedules called adult vaccination, where every adult should get knowledge about it from this in hospital. And obviously the other ways to prevent pneumonia is improving the nutritional status of our patients by giving them good proteins, high protein diet, etc. Exercises which will improve the immune system. Meditation and yoga pranayam will really help to improve the immune system. How it works is something which is very important to know, that yoga and pranayam do improve the immune system, and good sleep also improves the immune system. So change in the lifestyle, you can say, by walking, proper sleep, avoiding vices like smoking and alcohol and other tobaccos should be considered for preventing bad infection, and this can improve your immune system and we can prevent pneumonias.